The potential dangers associated with an impact to the head are pretty vivid when we watch contact sports, but the risk of brain injuries in the workplace cannot be underestimated. More important, it is crucial that you be prepared to provide quality first aid in the event of a blow to a person's head. Let's take a look at the root cause of a brain injury. Damage to the brain can occur from a significant impact to or rapid movement of the head that forces the brain to bounce within the skull. This is also known as a TBI, short for traumatic brain injury. This can cause swelling or bleeding and damage delicate brain tissue. The TBI may cause a mild concussion or a more severe and life-threatening condition. If you encounter a person who is exhibiting a diminished level of responsiveness after a blow to the head, assume that serious brain injury has occurred. The injury may be as simple as a mild concussion that will resolve naturally, but it could also involve damage to the brain and spine that can easily become life-threatening. A sudden fall can happen when you least expect it.
Well, I'll see you at lunch, all right?
Sounds good.
We'll see you then.
Ricky,
Follow these steps to provide first aid. Check the area to make sure that you and the injured person are safe.
Ricky, are you okay?
Yeah, no, I'm good. I'm good.
No,
I'm just gonna get up.
I need you to lay down and take it easy.
Make sure that the injured person is calm and remains as still as possible. Unless there is a risk of further injury, leave the person in the position that you found them. Also, be aware of some telltale signs that indicate a person has suffered a concussion. For example, they may appear stunned and dazed. They may not recall events prior to the fall, have a headache, experience blurred vision or nausea, disorientation, confusion, answer questions slowly, or perhaps even lose consciousness briefly. In a more serious concussion, one pupil may be dilated larger than the other. All are symptoms that indicate various degrees of concussion.
I need you to call 911. Ricky fell.
If there has been a spinal injury, movement can escalate the injury and cause paralysis.
Yes, we have an employee fell at the mine.
Always play it safe and minimize movement, then call 911. Most important, if a spine injury is suspected, stabilize the person's head with your hand. Do not allow them to get up and move around.
Okay, don't move his head. Make sure he stays still.
Head is stable.
All right, head is stable. Can you guys get out here quick? It's gonna be all right, man. Got you.
If the person recovers to the point where they are not experiencing any of the symptoms just mentioned, allow them to return to normal activity. However, they should be monitored closely. If they begin to have headaches, mood changes, nausea, or loss of balance, then medical attention is recommended.